biggest penis killer is smoking, because if it's blocking up all these other bodily functions, arteries, veins, all of that, then they're all the ones that are going to your heart and to your lungs are all big, they're the size of your little finger. The ones going to your penis are like tiny, so they're getting blocked first. So smoking and vaping is penis killer, and I think if they use that as the health message, we might have less problems with people smoking and vaping. Being overweight is also a really big problem. So if you think about if you've got a big belly, that means you're basically parking a car on the hose when you're trying to water the lawn. So that is stopping the blood flow going to your penis. As a side thing as well, for every 16 kilos of weight a man puts on, he loses 1.5 centimetres to 2 centimetres of his penile length. So staying within a healthy weight range is really important, and you're also going to get it to work a whole lot better. Alcohol, in moderation, is okay, but drinking to excess is not at all good for your blood flow or for your erectile function. And the other thing is stress. Your pelvic floor, and most men don't even know they have a pelvic floor, it's this group of muscles, basket of muscles that holds all your organs inside your pelvis so they're not falling out. But that pelvic floor is also responsible for pumping blood into your penis. When you're having an orgasm, it's what contracts. And the problem is if you're very stressed and anxious and you've got a high-stress job or you're sitting at a desk a lot, your pelvic floor can often become too tight. And so if it's too tight, it's the same as having a belly, parking a car on the hose. It's not letting the blood flow go through to your penis. So I've actually seen quite a lot of young men who the only reason they have erectile dysfunction is because they've got this hypertonic pelvic floor. Sexual health can be like the canary down the mine shaft. You might have erectile dysfunction, or as a woman, vaginal issues. All of these things can indicate that you have cardiovascular disease or diabetes and other things. Most people, if you ask them if they've had a heart attack, most men, within the 3 years leading up to it will tell you that they've had some erectile issues in that time. So I see it as primary prevention. If someone comes in and sees myself or one of my clinicians and they've just developed erectile dysfunction or something's changed in their sexual health, the first thing we do is make sure that their other health, their cardiovascular health, they've been screened for diabetes, and that we've checked all their other health, because yes, we can help with the sexual health issue, but most importantly, we want people to be healthy. So this can be that canary down the mine shaft of let's check out the whole person's health rather than just worry about the sexual health issue.